President Donald Trump has appointed Robert F. Kennedy Jr. to lead the Department of Health and Human Services, a critical agency with a budget of nearly $2 trillion. HHS is responsible for overseeing Medicare, Medicaid, and the Affordable Care Act. The agency also plays a pivotal role in shaping public health policies and ensuring the safety of medical products. Kennedy's appointment signals a shift in the agency's priorities, stirring both anticipation and debate about the direction of national health strategies under his leadership. Kennedy has pledged to pursue his Make America Healthy Again plan, focusing on the root causes of chronic diseases and childhood illnesses. His approach emphasizes prevention over treatment, with bold proposals that challenge established practices. Known for his controversial stances on vaccines and public health, his plans have drawn both support and skepticism. Kennedy's plans signal a potential shift in national health priorities that could have far-reaching consequences. This video will examine 12 expected changes under Kennedy's leadership and their potential impact on public health. These changes highlight HHS's crucial role in shaping the nation's healthcare landscape and ensuring the well-being of millions of Americans. Check out the full details by visiting the link in the description. Additional studies on vaccines. Kennedy has expressed concerns about what he perceives as gaps in vaccine safety research. He has called for more extensive studies to examine long-term effects and ensure that vaccination programs are based on the most comprehensive data available. Public health officials counter these claims, emphasizing that vaccines are among the most rigorously tested medical interventions, with decades of evidence supporting their safety and efficacy. Kennedy's push for further studies could lead to new protocols for evaluating vaccines, potentially slowing approval processes. This approach reflects his broader focus on increasing transparency and addressing public skepticism regarding medical interventions. Revisit federal vaccine recommendations. Kennedy has criticized the current childhood immunization schedule recommended by the Centers for Disease Control and Prevention. He argues that some vaccinations are administered too early and questions the scientific basis for certain guidelines, such as the hepatitis B vaccine at birth. Although these recommendations are not legally binding, they influence state policies and school vaccination requirements across the country. Revisiting these guidelines could lead to adjustments in how vaccines are timed and administered, impacting public health strategies. Supporters of the existing schedule emphasize its strong evidence base, warning that changes might jeopardize protection against preventable diseases. Take fluoride out of public water. One of Kennedy's immediate goals is to remove fluoride from public water supplies, citing concerns about its potential health risks. He points to studies suggesting links between fluoride exposure during pregnancy and neurodevelopmental issues in children. Public health experts argue that water fluoridation has been a safe and effective measure to reduce dental cavities for decades. Removing fluoride could spark debates over balancing individual choice with community health benefits. This proposal highlights broader questions about the role of government in implementing population-wide health interventions. Remove food dyes and other ingredients. Kennedy has called for the removal of artificial dyes and additives in processed foods, which he claims contribute to poor health outcomes. He has focused particularly on improving the nutritional quality of meals in schools, aiming to reduce exposure to potentially harmful substances. Nutrition advocates support efforts to limit ultra-processed foods, but critics question the feasibility of enacting such sweeping changes. Some have raised concerns that his claims may not fully align with the current scientific consensus on food safety. If implemented, these reforms could reshape food regulations and promote healthier eating habits nationwide. Ban puberty blockers for children. Kennedy has opposed the use of puberty blockers for minors, citing concerns about their safety and long-term impacts. These medications, which pause puberty for youth experiencing gender dysphoria, are supported by major medical organizations as safe and effective when appropriately prescribed. Kennedy's position challenges this consensus, suggesting that such treatments may carry risks that outweigh their benefits. Restricting access to puberty blockers would mark a significant shift in care for transgender youth, impacting families and healthcare providers alike. The debate underscores broader tensions surrounding medical care and policies related to gender identity. Increase access to raw milk. Kennedy has advocated for greater availability of raw milk, claiming it offers superior nutritional benefits compared to pasteurized milk. Proponents argue that raw milk has a natural taste and contains beneficial enzymes, but federal health agencies warn about risks associated with harmful pathogens like E. coli and Listeria. Expanding access to raw milk could require changes to existing regulations and create new public health challenges. Supporters see it as a matter of consumer choice, while opponents emphasize the potential dangers of foodborne illnesses. This proposal reflects Kennedy's focus on reforming food and health policies to prioritize personal preferences and alternative options. Before we continue with the video, take a quick moment to hit that like button and subscribe if you haven't yet. And don't forget to ring the bell for notifications so you never miss out on our latest updates. Plus, we've got some helpful resources in the description. Check them out and share your comments after you're done watching. Push out federal officials. Kennedy has expressed intentions to fire and replace 600 key officials at HHS agencies, including the CDC and the National Institutes of Health, whom he believes are too closely aligned with private industry. He emphasizes the need for leadership that prioritizes public health over corporate interests, aiming to bring fresh perspectives to these critical agencies. Replacing federal officials could lead to significant disruptions, especially given civil service protections that complicate such changes. Critics argue that these moves could destabilize ongoing public health initiatives, while supporters view it as an opportunity to address perceived conflicts of interest. This approach signals Kennedy's desire for sweeping reforms within the agency's leadership. Focus on chronic disease prevention. Kennedy has made chronic disease prevention a central focus of his vision for the Department of Health and Human Services. His Make America Healthy Again plan prioritizes addressing the root causes of illnesses, such as poor nutrition, environmental factors, and lack of exercise. This shift emphasizes proactive measures like promoting healthier lifestyles and funding research to understand the underlying causes of chronic conditions. Supporters believe this could reduce healthcare costs over time, as fewer resources would be needed for treating preventable diseases. Critics warn that redirecting attention may risk neglecting other vital areas like infectious disease prevention and management. Nutrition Department changes. Kennedy has signaled his intent to restructure the Nutrition Department within the Food and Drug Administration. He plans to shift resources towards studying the links between chronic illness and dietary habits, while reducing the focus on infectious disease research. Such changes could influence how dietary guidelines are developed and lead to stronger regulation of unhealthy foods in public settings. Advocates of this approach see it as a necessary step to combat rising rates of obesity and related conditions. Opponents argue that it might weaken the nation's readiness to respond to emerging health threats. Vaccine leadership changes. Kennedy has suggested bringing in new leadership at HHS to address what he sees as a lack of accountability in vaccine oversight. He has named potential collaborators like Marty Makary and Dave Weldon, who share his interest in re-evaluating vaccine policies while acknowledging their importance in public health. These leadership changes could create opportunities for dialogue about vaccine safety and transparency, although they might also heighten tensions with public health experts. Adjusting the balance between vaccine advocacy and scrutiny could impact public trust and immunization rates. This proposal reflects Kennedy's broader effort to instill reform across HHS's management structure. Limit abortion access. Kennedy has stated his intent to limit abortion access, aligning with conservative views on reproductive health. He has expressed support for policies restricting abortion rights, citing his belief that life begins at conception. Such measures could lead to significant changes in federal funding for reproductive health services and alter regulations surrounding abortion clinics. This would potentially impact access to care for millions of women, particularly in states with restrictive abortion laws. Critics argue that these changes could disproportionately affect marginalized communities and raise legal challenges regarding reproductive rights. Shift focus on infectious disease research. Kennedy has proposed redirecting resources away from infectious disease research to focus more on chronic illnesses. This shift could affect funding for programs addressing diseases like influenza, HIV/AIDS, and emerging global health threats. Advocates for his plan argue that chronic conditions have become the primary health burden in the United States and require greater attention. Opponents caution that reducing focus on infectious diseases may leave the nation unprepared for future outbreaks or pandemics. Balancing these priorities could prove challenging for an agency with wide-ranging responsibilities. Public health community concerns. Kennedy's proposed changes at HHS have raised significant concerns among public health professionals. Critics question his plan's adequacy in considering the complexities of implementing large-scale reforms in a bureaucratic system. His views on vaccines, fluoride, and chronic disease prevention have sparked debates about the balance between personal choice and collective health benefits. Experts worry that deprioritizing infectious disease research and altering established health practices could weaken the nation's ability to manage future health crises. Kennedy's leadership style and controversial positions may also create challenges in building consensus among stakeholders within and outside the agency. As HHS navigates this potential shift, the broader public health community remains divided on how these policies will ultimately affect the nation's well-being. Looking ahead, Kennedy's leadership at HHS marks the potential for a major shift in the nation's public health approach. His focus on chronic disease prevention, regulatory reforms, and vaccine policies highlights his commitment to reshaping the nation's healthcare priorities. These plans, while supported by some, raise concerns among experts about their scientific basis and impact on established health systems. Balancing innovation with evidence-based practices will be critical to addressing the challenges ahead. The coming years will reveal how these changes impact the balance between innovation and established practices. Kennedy's tenure is set to leave a lasting imprint on the agency and its role in shaping healthcare in America. Thanks for watching, and if you found this video helpful, don't forget to like, subscribe, and share it with your friends. Also, don't forget the link in the description.